Hello, everybody. It's an honor to be here and speaking. And so the tips today for circumferential ultra-complete arm liposuction, this is more directed to the surgeons here. And my disclosure is that I am the owner of Art Lipo, and I'm also the owner of the trademark for Celebrity Arms Liposuction, which is basically what I'll be talking about today. So the problem with traditional arm liposuction, and I think I'll be speaking to most cosmetic surgeons when I talk about traditional arm liposuction, but we know here in this room we have surgeons who are used to treating lipedema, and we've all had the need to evolve our techniques to treating things circumferentially. So I apologize if any of this is rudimentary to you, but these are my tips for how I've done it. So the problem with traditional arm liposuction is that it's done just on the underhang of the arm or the back of the arm, and it's done conservatively because you can't treat it completely unless you blend further up into the sides of the arm. So it leaves a lot of the sides of the arm and the shoulder untreated. And with fat disorders like lipedema, we really want to remove everything as completely as possible. So I actually started doing this circumferential arm liposuction about 2012 before I ever started treating lipedema. It was for cosmetic purposes then, and I really evolved this technique to do it high definition to reveal muscle contours and get the slimmest shape possible. So I've treated about 2,000 cases, and this type of sculpting is something that I had to develop because these things are not taught in training programs. In fact, training programs like residencies teach that you should not go anywhere outside the backside of the arm, or minimally so because of dangers, and we'll talk a little bit about those things later. So when we treat the arm circumferentially and completely, we get the best relief for lipedema. It's great because we also get a very nice cosmetic improvement also. And here's some examples. This is one of our lipedema patients. You can see she has a lot of fat circumferentially, so I'm just going to go through these quickly. And you can see the kind of volume change, the contour improvement, as well as one thing I will point out is the skin retraction, which we'll go into. This is a patient who's in her early 50s, and you can see she has quite a bit of hang there. I describe it's about 2 inches of hang underneath her arm. And you can see from this frontal photo that her skin is pulled up most of the way, probably about 2/3 of the way up. So it's left with about 1/2 inch of hang still remaining. And just another picture here. So tips for the surgeon. In my way of doing it, it's all awake. I've always done all my liposuction awake with tumescent anesthesia. But this allows me some things that I've used to my advantage in getting the best results. So I have all my patients tighten their muscles, and when we're doing the arm, it could be any number of positions, but they'll be flexed. That allows me to grab the fat, feel it, control it in a much better degree to achieve both completeness, smoothness, and accuracy in the sculpting. And I think that these things are much harder to achieve when you have someone under general anesthesia. We'll be talking about some other benefits of the muscle tensing in a second also. Number 2, more incisions are usually necessary. So in traditional arm liposuction, there's usually just 2 incisions, maybe one right here at the elbow and one toward the armpit. But when we're working around a cylinder and you got to go all the way around, it's generally useful to have a lot more incisions that allow you to move all the way around that circle. Number 3, superficial removal. I know there's been some controversy of superficial liposuction in the past, but for my 18 years of doing liposuction, have done things very superficially, both removing the fat from the deep planes as well as the superficial layer. And the benefit is major skin tightening and retraction. So I'm just going to show you a couple different positions that I work from. You may not be able to see it here, but she's actually tensing up her muscles. And this is one of the benefits of having patients awake and tensing, is that they can hold their body in any number of positions that you require. And when you're working around limbs, where there's so many different angles needed, it's very beneficial. So you can see from the one side, and then I can work from the other. So just talking about some other considerations. There's several things that doctors have been told during their training of why this can be dangerous. Operative bleeding is one, and it's true that on the sides of the arm as well as the shoulder, it's a little bit more vascular, and bleeding can be a problem when you're doing a circumferential arm. However, the arm is an area where you can easily apply pressure, and anytime there is a little bit of extra bleeding, that can be controlled easily by pressure of holding a couple minutes. Number two, lymphatic damage. So I was told when I first started doing liposuction, you can't treat circumferentially around a limb because it could damage the lymphatic system and lead to permanent lymphedema. And now that I've been treating lipedema now for over 6 years, and actually doing circumferential liposuction for almost 12, I can say that it's never been a case. So in the arms, at least, over 2,000 cases, I've never seen it. Loose skin and wrinkles is always a consideration, whether it's cosmetic, and even in my lipedema patients, my patients are concerned about how their cosmetic outcome is going to be. So preparation of expectations is the most important. I loved hearing Dr. Schwartz's talk, and he's got some great results. So brachioplasty is definitely needed in some patients. Renuvion, which we also offer for skin tightening, is something that's pretty minor. It's good for someone with just a mild laxity. So that's pretty much it for my presentation. And for any surgeons out there that would like to learn more, I welcome everybody to come and spend a day with me and see how I do it. Thank you very much.